And now it's time for the Valley Regional Healthcare Prescription Playbook. And we sat down once again with Dr. Ergen of Valley Regional Healthcare, and we spoke to him about an injury from Teddy Bridgewater that he suffered earlier in the year. Let's take a look.
Well, a dislocated knee usually requires tearing more than just the ACL. Dislocating your knee means that the end of the thigh bone, the condyles of the femur, separated from the upper end of the shin bone, the tibia, in a way that at least the ACL is torn. Often the PCL, which is the posterior cruciate ligament, is torn, and usually one of the collateral ligaments on the inside or outside part of the knee is torn.
That sounds really bad.
It is really bad. Often if it's just one of the collateral ligaments and the ACL that went for the tear, then that's a better case scenario. But sometimes if the PCL is torn also, then you've got to reconstruct all three ligaments. In order to reconstruct the ACL and PCL, you have to place a graft where the ligament used to be, because the ligament fibers are torn, and you can kind of think of it in terms of the end of a mop. You can't sew two mops together by sewing the ends together. It's just not going to hold up, and that has been proven over time. So you place a graft, which is tissue that's either borrowed from the patient's normal structures or from donor tissue, we end up drilling holes in the bone and passing the graft along the course that the ACL or PCL normally takes. In many cases with a dislocated knee, if the joint capsule is torn, it actually makes it more difficult if you do surgery right away, because a lot of the surgery is done arthroscopically and the water will leak out of the knee, and you can't really see what's going on. So you do have to wait a little bit. But if there's lots of ligaments torn, you may end up with a lot of scarring, so you don't want to wait too long. There's sort of a balance there in terms of how the knee looks and when it's ready for surgery. A long rehab. A dislocated knee, you're definitely going to be out for the full football season. Your goal is to be ready to go basically a year after the injury happens. Maybe 9 months, maybe 10 months, but basically a year. Well, for just a torn ACL, which can happen without dislocating the knee, that it's possible to get players back to sports as soon as 6 or 7 months. In general, now people are waiting a little bit longer, and it's more like 8 to 10 months.
All right, that was Dr. Ergen, and thanks again to Dr. Ergen and Valley Regional Healthcare, the prescription playbook every week. And Brett, talking Teddy Bridgewater, a pretty gruesome injury, as they said, back in August when it happened. There's still some conflicting reports if he's coming back. Do you think he will be able to come back, or do you think this is Sam Bradford's team now?
I think they should learn from the lessons of RG3 in Washington. He came back from a devastating knee injury, and you could even say they played him when he injured it in that same game. It seems so long ago.
Right.
But this is an injury you can't rush. If Teddy Bridgewater's your guy moving forward, if he's locked up, I don't know what his contract situation is, but I think he's locked up long term. You got to let him take his time and get comfortable. A knee injury, it can go one way. You could be fine. I mean, today's modern technology and modern medicine usually helps, but you just don't know with those type of knee injuries and the severity that he had it.
And you wonder if the Vikings, it plays into their hand at all what they gave up to get Bradford. Are they more inclined to play him? Because that comes into play a lot too, whether it be anyone from the Red Sox when they signed Pablo Sandoval for the money. Oh, we paid him all this money, we got to play him. So does that come into their mind with the Bradford and say, well, we've got this guy, we got to play him?
You gave up a lot, right? You gave up a first-round draft pick for him.
Yeah.
I mean, I just think it really has to, when you look at the Vikings, I mean, I think there's like a whole other issue as far as, there was issues with the players not listening to the coach, and they blew it down the stretch. The question is, who's the head coach at that point in time? I think that's a serious question they need to ask. But if it's, if Mike Zimmer's in a situation where he needs to win now, he might be forced to play his hand and go with the Teddy Bridgewater if Sam Bradford struggles.
Right. All right, so next week we'll talk more to Dr. Ergen about maybe the psychology of getting back onto the field and how it does affect Bridgewater once he gets on the field, at what point. We're going to take our final break. When we come back, we'll get in some Red Sox talk, some spring training almost underway, and then we'll also have our Salt Hill Pub picks of the week. You're watching YCN Sports Talk.